Hi, everyone. My name is Suchi Shah. I'm a therapist with SVA. And today we have a very special guest with us to talk to us a little bit about something different that we don't usually talk about on this channel. We have Dr. Bhvaik Sheth, who's a doctor of physical therapy, and he's going to talk to us a little bit about what is physical therapy, the connection between the physical body and our mental health, and talk about a lot of things that come in between. So I'm going to open the floor to you, Bhvaik, and have you just introduce yourself, tell us a little bit about you and your practice.
Hi everyone, my name is Dr. Bhvaik Sheth. I'm a physical therapist since 2016, and I started my private practice in 2019. So I'm a physical therapist mainly working with orthopedic conditions, so people who have back pain, neck pain, knee pain, or difficulty moving around the home. And usually people think there's like a certain demographic of people that fall under this type of care, but I have kids as young as like 2 years old, and I have my oldest patient currently is 103. And it's such a really fun experience where I'm working with a lot of different people, different lifestyles, and my main job is to teach people how they can live their life with less pain, more physical activity, and overall they're able to do more things in the same 24 hours that everybody has in their day. I love what I do. It's really rewarding, and the best part about my day is just going to somebody's home and just talking to them and getting to know the new things that they were able to do this week that they weren't able to do last week. I started my private practice in 2019. It's called Elite Movement Initiative. And the main reason I started my private practice is to encourage and promote physical activity just in our communities. There's a ton of opportunity here for people to get outside, get more active, be social, go to the park, and just go for a walk here and there. And I feel like that's such an important part of healthcare that doesn't get talked about enough. And even working in physical therapy, we get focused so much on the anatomy or the person's body, but we kind of forget about that this person is interacting with a lot of different people. They live in a town or a community. They have many different responsibilities that they need to do, and they also enjoy to do. So there's so much more to a person rather than just their neck or their shoulder or their knee. And ever since starting my private practice, I've been able to spend more time talking about a person's life rather than their body. And that's been a lot of fun for me.
And absolutely, I think what you're describing makes a lot of sense to me as a mental health clinician, right? It's not about what's specific or what that specific problem is or what that one thing is that they can't get over. It's more about everything in between. What is the holistic view of this person, and how can we tackle different aspects of their life so that we can make the person healthier overall? Start us off really talking about what is physical therapy, right? A lot of times we hear people say, oh, the doctor told me to make a physical therapist appointment, but what is that really? Like, do I even need that? So give us kind of like an overview. What is it? What happens in a session? What is like a typical day for you even look like?
Yeah, so just globally, physical therapy is the part of healthcare where in order to treat a medical condition or a physical condition, you do physical activity to improve your body's resilience, and you're able to do more activity. So for example, if somebody has shoulder pain or neck pain and they get referred to physical therapy for them would look like first identifying and diagnosing what's causing their difficulty with movement, and then figuring out what parts of their body we can improve so that that impairment goes away and they're able to have more range of motion, they're able to do things a little bit more. So ultimately, physical therapy uses movement to treat medical conditions. Physical therapy is such a broad thing, and more specifically, what I work on my day-to-day, the physical therapy that I practice is a little bit different than a traditional physical therapy experience where people will go to a clinic and they'll get evaluated by a therapist in an office setting, and they'll do all of that work there. What I do is I travel to my patients' homes And I kind of immerse myself a little bit into their day-to-day and figure out what parts of their day can they do more movement to reduce their medical conditions, reduce their pain or their discomfort. So my day-to-day, I either drive, take the train, walk to my patients' homes, or their offices or their athletic fields, and watch how they move. Once I watch how they move, I'll test out a few different motions, and then we just do a lot of exercise together. So whether it's somebody that's 103 years old, we're having her sit in her bed, do a couple exercises for her shoulders, couple exercises for her knee, and then we teach her how to walk from her bed to her bathroom. For a 15-year-old, sometimes I'll go to Central Park, watch them do some of the drills that they practice either in lacrosse or swimming, and then we'll do some exercises in the park because it's a nice day. Let's go outside and do therapy there rather than being stuck inside of somebody's home. So there's a huge, my day-to-day is very varied, but that's what kind of keeps it fun and also keeps it a little bit more true to the experience.
I'm curious to know how you feel about using exactly what you're saying with artists who spend hours upon hours sitting in one position, getting that perfect stroke, doing whatever programming or whatever they need to do. What do you think about that? Like, these are, you know, a lot of these students that we have are not willing to get up and move because the time is so valuable to them. They're so immersed in their work that they don't think that they can actually get up and go for a walk, or they don't feel like I'm going to hit the gym because I need to get this done before a deadline so that I can either like do my projects or even like get paid the next day.
Yeah, I completely hear what you're saying, and I can completely respect and understand the fact that artists have such a demanding lifestyle, especially when it comes to anything with more creativity that's a focal point of their work. If you kind of leave that environment, I can see how it messes up your flow. And this is something that I've experienced a lot with writers as well, or even like lawyers, that they just need to like buckle down and focus. And if they do something else, they lose their focus as well, and they kind of get off that train. So ultimately, you can always find a way to be physically active no matter where you are. But it takes a little bit of creativity from our side. So as a physical therapist, this is something I've actually learned more from an occupational therapist that I work with, that if I go into somebody's workspace or their home space where they're working, the first thing I'm going to do is just kind of like walk around and kind of see their space. I'm going to see how they're using their space. Is there things in their space that they're able to either rearrange or modify a little bit just so they can become a little bit more active, or it can reduce the amount of stress that they're putting onto their body. So it's not always about me changing a person. Sometimes it's about me changing their environment. And that's something I can only do in an artist's space or a lawyer's space or a writer's space. I need to go there, observe their environment, and then make a little bit of a change here or there. And it could be something as simple as changing an ergonomic setup. So maybe changing how they're sitting or standing while they're, doing their artwork. Or it could be something as simple as introducing a new type of device that they can put into their space, so it takes pressure off of their body that might be uncomfortable. And this is something that's hugely valuable, not just to artists, but there's so many people. Like, I've worked with teachers, and if you go into a classroom, sometimes you can see how a classroom isn't always necessarily set up to help teachers do their job better. It's set up for the students to kind of line up in a row, so it's easy to just observe students, not necessarily take care of the teacher. So my job is to make sure I can go into their space and be their ally, be their support, and kind of take care of them, so then they can take care of their work.
And I love that you mentioned creativity and how you kind of go with that flow, right? Something that you said earlier that I would love to emphasize is that you can be physically active wherever you are. Mm-hmm. Just because you're sitting in a space doesn't mean that you can't have movement. And so I'm going to shift the conversation a little bit to ask more about this intersection that we see between physical health and mental health, right? Earlier, I had mentioned that the brain and the body are so connected. And so I'm curious to know what you've noticed within your practice. What do you think about mental health? Have you even noticed an impact between them, and what your thoughts on those are?
Yeah, definitely. And even more to that point, you know, when people use the term mind-body connection, it seems like there's a disconnect, but they're disconnected. You know what I mean? They're two different things.
100%.
And then there's a connection between them. And I started, you know, in the beginning, that was something I definitely believed in, that, you know, once you like practice things mentally, your body will physically be able to do it later. But now, as I've, you know, been talking to more and more patients of mine and learning from my patients as well, it's kind of shifted my thought process a little bit. And I don't necessarily know if I like the term mind-body connection anymore, because it sounds like they're separate things, but it's really just one thing. It's just them as a person, right? Rather than thinking of them as a physical person with a body and a mental and cognitive person with a mind, they're a person. So ultimately, when it comes to like physical health and mental health, it should always be directed towards helping a person be more of who they see themselves as. And this is something that I experienced when I was 20 and 21 years old. I hurt my knee playing basketball and I needed surgery, and I was doing a lot of therapy for it. And I always identified myself as an athletic person. I loved sports, huge part of my identity. I loved to dance, was on a couple of dance teams, would compete nationally. But when I got hurt, I was less of the person that I saw myself as, and I was less of an athlete, less of a dancer. And then even most of the friends that I had in college, I would play basketball with, or I would go work out with, go for a run with. Even like some of the games we would play socially involved some kind of physical activity that I really wasn't able to do that well, because if I'm on crutches, if I have a knee brace and I have to walk 30 minutes to my friend's dorm, like a 30-minute walk ended up taking like almost an hour and a half to 2 hours. So even just me being a person, I felt less of a person that I really remembered because of my knee surgery and my knee pain. And absolutely it affected me physically because I was more tired. I had knee pain, so my knee wasn't bending that much. My knee got weaker. So there's a lot of these physical things I was slowly improving with therapy, but then also the mental side of things where I wasn't sleeping that well. I ate a lot of ice cream during like those 3-4 months. Just, you know, I needed to find some kind of pleasure because I couldn't play basketball for pleasure anymore. I definitely felt like I felt my mood change. I'm a very like upbeat, very happy, very loud person. But during that time period, I was more isolated, kind of, you know, talked to just a couple people rather than talking to like 20 or 30 people, less social, went out to like hang out with friends less and less. And it definitely affected me mentally as well. And socially even more. And that's something that it took a lot of time, but it also took like it took my therapist. Honestly, like one of the big reasons I got into physical therapy was the therapist I had at that time. Um, he really like kind of understood where I was coming from, that I felt less like a person. And one thing that he kind of really inspired me to do in the beginning of my therapy process was like, he's like, yeah, fine, you can't go play basketball like as you used to, but you had like, you know, like those little like hoops you can stick on the back of your door. You like, just put it up and just stand, practice balancing on your left leg and just take some shots there. Like it's a way that I could do my therapy exercises to help my balance improve on my left leg, but then also do something I enjoy. And he really like took that time to make sure me as a person was getting my personality back while my body was recovering. And that's just one example, but it started off really early in my foundational timeline, where it kind of helped shape how I practice therapy ever since then. And now that I'm a therapist, I really make sure that I try to incorporate what people like doing, whether it's music, whether it's sports, whether it's art, whatever you enjoy doing, that needs to be a part of your physical therapy, because that's going to keep you engaged. It's going to keep you doing things a little bit more. And that enjoyment factor, I think that's such a huge part about mental health. Like, you need to like enjoy what you're doing. And if you don't enjoy things, that's fine, but you need to find some place where you feel like you're able to live your life the way you want to live. So I think I kind of touched on it.
I think you did too. And thank you for sharing your experience as well, because I think what you're saying makes a lot of sense, right? Like, the mind and the body are not two separate things. They work as one. And so people often say like, yeah, like I'll think about my mental health later. I'm going to hit the gym. I'm going to go do this. I'm going to lose those 10 pounds and I'm going to be a better person. But your identity is not linked to one thing. And what I'm hearing from you is that that's something that you've experienced, something that you've really understood, is that my identity was not who I was at that moment. It came from so many different aspects. And being able to work on your physical health while you were working on your identity, while you were working on what can I enjoy now? How can I find time to make like that social life that I'm missing, that I haven't had for a while? How can I find time to feel good about myself, right? Like that sense of enjoyment. I'm not sure if I would call it enjoyment, but I would call it really like this idea of what can I do as a person that's going to make me feel good inside about myself. That is so valuable to find. And a lot of times people think of it either kind of in like black and white, like I'm either going to do this by losing 10 pounds at the gym, I'm either going to do this by working only on my physical health, or I'm either going to do this only on working on my mental health. But they don't realize that everything works in cohesion. I know that I work with a lot of students who will say to me, but I've done the core values. I've done like, I'm challenging my thoughts. I'm doing perspective taking, and all that is so wonderful. But I'm not going to go take that walk when I'm feeling that bout of anxiety. I'm not going to go like, I'm not going to initiate a conversation with friends when I feel lonely. And those are things that also add into that. And we think about it in terms of like, moving my body can help me, but people don't understand that the brain is an organ that works like a muscle. I need to work out my brain the same way that I work out my body, because both things are working together. And when both things are in cohesion, that's when we find that sense of inner peace. And I find that a lot of people use that term inner peace and say like, oh, I'm going to find inner peace in whatever. The inner peace really is when what's in here is matching what's in here to matching what's on my outside. And that's what I'm hearing from you, is that finding this sense of inner peace is so much more than just fixing your need, than just getting your clients or your patients to go and work on their back or their shoulders. It's really understanding where a person is coming from, finding what they need and making it about them. And that's when I change.
That's such a huge part of physical therapy, right? Where what's the point of improving your balance if you're really not leaving your home, right? There needs to be a higher purpose than that, right? So for my patient that's 92 years old, she has difficulty balancing. Definitely that's something physically that she has. Now, she is also affecting her sleep. She feels a little bit more depressed or tired. She feels like she's not able to hang out with her friends. Now, just by improving her balance, that doesn't mean everything else is going to happen. It's not like she's going to magically feel better just because, oh, my balance is better, I can stand on one leg again. Hey, I'm happy. Like, that's not how it works. Like, we really need to take that second step afterwards. And ultimately, I don't like to think of it as like, when there's goal setting and there's all these things, ideas that people talk about, it's okay, I'm going to do X, Y, and Z, so this happens. right? And absolutely, I think that central point needs to be like the focus. Rather than saying step one, step two, step three, and then this thing happens. For me, it's more like, okay, this person, this patient that I'm working with, she wants to go to Lincoln Center. They have, during the summer, they have a lot of these events like salsa dance classes or just outdoor concerts. She wants to do that. So that's at the middle. Okay. Now we're going to improve her balance a little bit so she can do more of that. We're going to improve her endurance. So we're going to practice walking longer distances so she can get to Lincoln Center walking, and she won't get tired getting there. So that's another thing we're working on. And then another thing, like, she does have a little bit of back or knee pain once in a while. So we need to make sure we're improving that, because the central idea is we need her to go back to Lincoln Center. And it's not a step one, step two, step three thing. It's everything should point towards why this person is doing something. And, the inner peace thing that you were mentioning before, like, as a physical therapist, this is something that I see a lot, and I'm sure a lot of personal trainers see this as well, or a lot of people in the physical side of healthcare or fitness see this, where somebody says that, oh, if I lose 10 pounds, I'm going to feel a lot better, or I'm going to feel more confident, or they say a lot of these things, but they don't realize, and this is something I try to coach my patients and my friends into as well. Losing 10 pounds, yeah, that might be very important, but that doesn't mean that's going to magically make you feel happy. You got to feel happy while you're losing 10 pounds. Yeah, lose 10 pounds, that's fine. That's good for you. And that will definitely improve your health. But you got to be happy while you're losing 10 pounds, not lose 10 pounds and then be happy. It's got to happen together. It's not a two separate thing. It's not your body is doing one thing and your mind is doing another thing. It's all working together. And the brain as an organ, it's such a cool concept, and I completely agree with that statement. And this is something that, let's say, like, you have somebody has heart disease, right? The heart is an organ, so we're going to like work on it, but then that's just one part of their body, right? We don't necessarily separate the heart from their legs or their spine or their knee. We don't separate the heart from the rest of them as a person. So why do we do that for the brain? So
Yeah,
I definitely agree with that.
And I think what you're saying makes so much sense, right? I see this so much within my own practice. Like, if this happens, I'll be happier. And I think a lot of people don't realize that happiness is internal. Whether you are, it's a choice, right? I choose to be happy right now because I'm making that like cognitive choice. And if I'm not choosing to be happy, there might be a thousand reasons why, but losing those 10 pounds isn't going to magically change me. And I think that's something that a lot of people do struggle with. I think that's something that a lot of young people struggle with, is this concept of steps. Like, I'm going to do this, then I'm going to do this. I'm going to burn myself out and stay in that studio and not sleep.
Yeah.
Because once this project is over, I'll be happy. But then after the project is over, I'm still not happy. And now I'm even more stressed. And now I'm grumpy and cranky because I haven't slept for so many hours. And people really use this in the way that they see physical health and mental health is, a lot of times I hear, like, why would I need to move my body if I'm working on my brain in sessions with you? And so we're going to start wrapping up soon because we're running out of time. And Bhvaik has agreed to do a little bit of an activity with us. And so I'm going to open it up to you, have you explain what this ending activity is going to be, a little bit about like how it can be helpful, especially for artists who are sitting at their desks for like 6 hours at a time sometimes.
Yeah. So ultimately, the best thing that anybody can do for their physical health is to move. So some kind of movement. And as artists, whether, more physical art, more digital art, any kind of art you're doing, you're usually doing something repetitively over and over and over again, or you're practicing. Like, if you're a musician, you're practicing for many, many, many hours. And anytime there's repetitive movements, it can build up a little bit of stress in your body. So what I like to promote and encourage is just a variety of different movements, a lot of which, you kind of have to get a little creative, but you can just use your workspace. You can use your chair. You can use your desk. You can use anything you have around you to help you move a little bit better. So I'm going to just show you a few different movements. Just join along, copy along, but these are the ones that help me feel better. So try them out. And if you need different types of movement exercises that help you, just kind of get creative and try things out on your own. We're always here to help you if you need a little bit of guidance as well. So for me right now, I have a little bit of neck and upper back tightness. So I'm going to show a couple of exercises that I like to do more for my neck and upper back. All right. So I'm just going to lower my camera a little. Chair. So while I'm sitting, I'm just going to reach for the floor. So I'm just going to sit and bend down. So if you have your feet on your floor and you bend down and just try to really stretch down to the floor as much as possible, your upper back, maybe your lower back might loosen up. So I like to do this maybe 10 to 20 times, just bend and touch the floor. So just a few times, just a simple bend, and a few times after that, just a rotation. So hands behind your head and twist. And any kind of movement, it should feel good. If anything is hurting or anything feels uncomfortable, just try it a little different. But the point of this is it should help you loosen up. It should help you feel better, and it should make you feel like you have more energy to get back to work after you're done. It shouldn't feel like it's draining you, and it shouldn't feel like you're too tired to get back to work after. So those are a couple of stretches I love to do. Another one, same position, hand behind your head, or you can just have your arms straight. Oh God, I bent to the side. Oh, I felt that a big stretch right there. Oof. So I'm a little tight today. So this is something that I would do in between sessions, or even while I'm teaching my patients some stretches, I'll do some of these with them because we all need to move a little bit, myself included. So this one actually feels really good to me. For me, like the right side of my body is a little bit tight today. Couple other things you can do is just more bending backwards. So this might be a little uncomfortable. So then in this situation, rather than doing it sitting down, I'd rather do it standing up. I'm gonna stand like right next to my desk, hands overhead, and just bend backwards. And as you can imagine, if you're sitting in this kind of position for a while, this is gonna help just do the opposite motion. And if that's uncomfortable, you can do the same thing, just hands on your hips, bend. And there's a concept in physical health called movement breaks. Just take like a 1 or 2 minute break in the middle of activity, just to kind of let your body loosen up, let your body free up a little bit, and then get back to work. It doesn't have to take 10, 15 minutes, even a 2-minute break here and there of just moving around, even just kind of like stretching your legs, just getting the blood flowing a little bit more. It can help to, number one, just make you feel better, but then also just to reduce stress in your body so you can get back and focus a little bit better. And, I don't know about everybody, but me, when I was a student and I was studying and reading like hours and hours and hours, if I'm stuck on a page and I just can't get through that page, I would just take a break, stand up for a minute, just do a couple exercises. I'll do a few squats. I'll just do a few stretches. And that made it easier for me when I got back to my book. It got me through that page without feeling stuck. So if anybody feels like they have a block, or they're just kind of at a point where they're just not able to really go through, and they're just been sitting at the same page or the same screen for like 10-15 minutes and not really making progress, take a break. Just stand up, loosen up, stretch for a few minutes, and then get back to it. Because if you're sitting for 10 minutes and you haven't made progress, it might be 20 minutes until you make progress. So why not just take 2 or 3 of those minutes and just do something different? Those are some of the stretches I like to do while I'm just at my desk. And again, the point isn't to magically make things better. The point is just to increase your amount of physical activity a little bit at a time. And you're not going to get amazing, life-changing results just by stretching for 2 minutes. But you'll notice that your work won't get worse from taking a 2-minute break. You're not going to miss a deadline by taking a 2-minute break. Usually, quite often, it's going to help you become a little bit more efficient and better at getting the creative juices to flow. So
100%.
That's what I like to do.
Make the mental break a physical break. Why not? Thank you so much again for joining us today and for sharing everything that you shared. For anyone who's interested, I'm going to have Bhvaik's information listed below. And if you want to book an appointment with him, please email us. We will send you all his information. If you'd like to also book an appointment with us, you can also reach out to health@sva.edu and we'd be happy to get you connected. Thank you again, Bhvaik, for coming in. And it was really nice talking to you about physical health and mental health and everything in between.